Nobody prepared women for what happens after 35. Not our moms, not doctors, not even gynecologists. The strangest part is it doesn't happen overnight. One day you're sleeping fine, maintaining your weight, feeling sharp and energized. Then, seemingly out of nowhere, you wake up at 3 a.m. You gain 10 pounds despite eating the same. Your hairbrush only has more hair than you've ever seen. You become anxious over things that never bothered you. You look inside the mirror and think, still look the same. It's me, but I don't feel like me anymore. And women come into my office every single week asking me the same question. Am I crazy? The answer is obviously no. But the thing is, I remember taking care of critically ill patients during COVID. Women in their 40s, 50s, women who are CEOs, physicians, attorneys, they're leading companies, and they can manage so many things. But when it came to understanding what's happening inside their own bodies, they felt lost because we spend decades learning about menstrual cycles, about pregnancy. We learn about menopause, but nobody teaches women about the 10 years leading up to menopause, perimenopause. And for many women, this is the decade that changes everything. So here's what's actually happening. Women lose approximately 30% of their collagen within the first 5 years after menopause. Estrogen receptors aren't just in our ovaries, they're found in the brain, skin, hair follicles, muscles, bones, blood vessels, even tissues that regulate sleep. Estrogen influences serotonin, dopamine, gabapentin, and mitochondrial energy production. So, as ovarian hormone production becomes less predictable, women often experience brain fog, insomnia, they can't sleep, weight gain, anxiety, hair shedding, joint pain, loss of muscle, reduced libido, skin thinning, and abdominal fat. What's fascinating is that studies suggest women become metabolically less efficient during this transition. Muscle mass naturally begins declining, resting energy expenditure drops, insulin sensitivity worsens, which means women are often blamed for not trying hard enough, when in reality, their physiology has fundamentally changed. Now, this isn't laziness, it isn't lack of discipline, and it certainly isn't vanity. It is biology. So what should women do? Well, first, lift weights, not because you want to look toned, but because muscle is one of the strongest predictors of healthy aging. Second, eat enough protein. Most women over 40 are dramatically under-consuming protein. Aim for roughly 1 gram per pound of ideal body weight, but this is variable. Third, optimize sleep. Sleep is where growth hormone secretion peaks, where tissues repair occurs, where metabolic resilience is restored. And fourth, ask better questions. Instead of, am I getting old? Ask things like, am I supporting the body for the decade I'm in actually right now? And finally, find a physician who understands prevention, not just disease. The women I see aren't really trying to become 25 again. They're trying to feel clear, strong, confident, present, like themselves, maybe for the first 10 years. And perhaps that's the greatest misconception about aging. Women don't want to look younger. They want to recognize the women looking back at them in the mirror, and that women is still there. She may just need a different roadmap. I'm Dr. Rizwana Zaidi, and if no one prepared you for this decade, I intend to.